I think this is probably the earliest I've ever signed on to a meeting.
Jana, do you want to start with any updates that you have? I know you sent a message earlier this week to CSPs in response to some questions about rapid testing. Maybe a follow-up on that.
Yeah, sure. Everyone that sent in a request for rapid tests, those tests have been ordered, and I did get confirmation that they've been shipped. So if you haven't received yours, they should be coming any day now, I would say. Other than that, I don't have a lot of updates unless you guys have questions.
I would just say thank you. Those make a big difference in our ability to address concerns that are happening in the houses very quickly. So thank you for getting that done.
I echo Nathan on that. Thank you very much.
You're welcome. I would like to have some feedback from you guys. Have you guys received yours, or are you still waiting?
Code Abilities has received tests, yes.
New Horizons
Ability Building Services received our test.
Great.
Southeastern's still waiting.
Okay.
Aspire is still waiting.
Dakota Milestones is still waiting.
Black Hills
RHD
Special
received.
Services is still waiting.
RHD received ours.
And HTC received theirs.
Liv is still waiting.
LifeQuest is still waiting.
DCI still waiting.
Still waiting from Valiant Living.
Okay.
Correction, Aspire just received ours in the mail today.
Great. Perfect. Yeah, if they didn't get mailed out on, all the orders were entered by Friday. So if you submitted your order on Friday to me, if you requested it to me, I entered it immediately when I received it. So the latest that any orders will be shipped is Monday. So I would think today or tomorrow, for those of you that are waiting, would be probably the latest.
Okay, are there other questions or concerns or follow-up that we need to talk through today?
I guess I have a question in regards to the vaccine. Are we ready to move on to another topic? Okay. I was just listening to the governor's address, and Kim Olson-Risden was on talking about vaccine, order of vaccine. And I'm going to go back to my notes because I tried frantically to write some. And she was talking about 24,000 doses coming into the state of South Dakota, probably by the end of the year. And first people to get that would be frontline healthcare workers, of course, those working with in hospital settings. And she mentioned something about long-term care workers, and I took that to mean nursing homes and such. And then she went on to say the next would probably be residents of nursing homes. I guess I'm kind of wondering where are community support providers falling in that? I mean, is our workforce going to fall right up there in the long-term care nursing home workforce? And if not, where are we falling? So if we could get some sort of answer, I don't know if I need an answer, but well, maybe it would be kind of nice to know where are we falling?
So Pam, I can speak to
Yeah,
what I know, or my understanding of the situation. And that is, of course, yes, the long-term care providers would be nursing home healthcare workers. And then we are a priority population, and we are priority mostly because of the congregate setting. So, which puts us kind of in the category of, like a nursing facility or other healthcare facility. But so we are a priority group. Our numbers were sent to the CDC. But as far as how much vaccine and how it's going to be distributed and who's going to agree to take it, those details, I just don't know. I don't know if Tom can speak to anything more that he might know.
No, Jana, that's really all I know too. And I'm not even sure if the health department could answer to that specificity too, because again, they don't know what the uptake's going to be and how it's all going to play out, I'm assuming.
Okay, thanks.
Okay, other questions? Other topics we need to talk through?
I guess I would just ask that you continue to advocate for us. On an earlier call with some of the CSP directors, we talked about us ourselves going in and working shifts, and our workforce is extremely stretched. And so as you continue to advocate for us, we would certainly appreciate that.
Yeah, Nathan, we certainly will.
We're a quiet bunch today. Other questions on COVID?
This
Thank
is
you.
Jennifer.
Yes.
With I'm going to go back to the tests that we just received today, the rapid tests and the CLIA waiver that we have. Is there any limitations? Like, I'm trying to figure out, while our nurse submitted that, are we limited to, like, who can do those tests? Is that an agency determination? Is that only our nurses can do those tests? Can you help clarify for me as we start putting those to use? I did see the guidance and I didn't see anything specific as to if there's any limitations of who can be conducting those tests.
Jana or Tom, have you heard any requirements around that? I know I can't speak to that with confidence, so.
So I think that's a great question. And so, and a little bit of a gray area, because my understanding is that, of course, with some of the mass testing, like the National Guard and individuals themselves have been administering their own tests. And then I think members of the National Guard that have some training have been doing it as well. But I think, and I can certainly reach out to the Board of Nursing, because I think that's a good question. And with an actual facility, I think, we would want to be careful, because you would want to make sure that somebody has appropriate training, especially in infection control with, a virus like this, and collecting a test specimen and things like that. So I think the answer is not probably a solid answer that I can give you, but probably with the correct training. And then if you feel comfortable with that as an agency, I certainly would have a policy or something in place on how you're going to go about, facilitating that. But I think that's a gray area and can get kind of, you would have to be careful with it as an agency.
Jennifer, I'm willing to work with Jana to see if we can get some solid guidance on that, if that's helpful for everybody as you look for next steps. Okay.
I would appreciate that. We want to be able to roll this out, and yet we want to make sure that we're in compliance if there are certain limitations that we were unaware of or hadn't been communicated to us. So we appreciate any further guidance. Thank you.
Absolutely. We'll explore that and get back to you guys as soon as possible.
So Jennifer, yeah, I'll certainly reach out to the Board of Nursing, because that's something that your nurse is going to have to delegate to a non-licensed individual. So then, I'll just kind of get the steps and get just further clarification for you guys and see if that's something that you want to do.
Okay, thank you.
I just have a kind of a general question, I guess. Is anybody having issues with hospitals being full when it comes to COVID? I guess we're running into it a little bit in our neck of the woods. We're closer to North Dakota, though, than South Dakota. And so our rural hospitals who were taking overflow patients from the bigger hospitals are now full. And I just heard the governor say that the capacity in South Dakota for hospital capacity is good. So I'm just wondering if it's our geographical location, or if others are realizing the same thing through their local hospitals.
We've had both. We had one person who needed to be admitted, who had COVID, was positive, needed to be admitted to the hospital, and they had to hang out in the emergency room for 8 hours until a bed opened up here in Brookings. And we had another person with COVID that the doctor said should be admitted to the hospital, but there was no room and nobody being discharged at any time in the near future. So they sent him home for our staff to care for, and they had somebody from the hospital calling every couple of hours to see how they were doing. So it's been an issue for us here in Brookings.
We kind of got that same thing today where I think one of the people we support would otherwise be hospitalized, but they told us, it's a gentleman who lives in an apartment, and they told us that we should be checking on him every 3 hours. And so I'm just wondering how that, it's just for somebody who had minimal supports before, we're now going to be pretty intense for the next 2 weeks. And I'm just wondering if other people are sensing that same thing, I guess, across the state.
Yes. We are too, Julie. We're running into that. I don't know what we'll do.
The bulk of our infections in Aberdeen have been in people in their own apartments that we have had to increase the staffing from typically 1 time a week to 4 times a day, or for some 24 hours a day in an alternate setting in their apartment.
Is that because hospitals were full?
A variety of reasons. They'd went through the hospital system, the nursing home system. They didn't meet criteria for oxygen levels, certainly bed issues. There's a variety of reasons. There's multiple people that this has been affecting.
So Joey, is there extraordinary needs funding or anything out there for those types of situations where we're getting a very low daily rate for some of those people, and now we have extraordinary costs?
Yes, so
most of the time it's overtime costs.
Yeah, so Julie and I have had some conversations actually with some of you about this very issue. So yes, please reach out to us. We are happy to work with you.
I have a sort of on topic question, but we ran into a situation that we've never experienced before. Somebody that had COVID and was in the hospital returned home for about a week and a half, had to return to the hospital. The person is 90, and they suggested to the guardian that they have nursing home placement. And when they went through the PASSAR, they said that they were not eligible for the nursing home. Jana, is there different standards than there was before with the PASSAR? And I guess I thought once you were of age, that nursing home placement wasn't an issue.
Yeah, so that person is 90 years old?
Correct.
Okay. And so I don't know if everyone's quite aware of the PASSAR process, but that typically there's a level 1 and a level 2 PASSAR. So the MRT nurse consultants in the state approve the level 1 PASSARs, and then when it jumps to a level 2 is when I review and approve it. So I have not seen that PASSAR come through my desk. So I would say that does not sound correct to me. And if you want to email me that information, I can check into it further for you.
Thank you.
But you're right. At this time, there is an age categorical exemption into the nursing facilities, and that age categorical is 75. So that person would meet that age categorical and should have been admitted from what you're telling me. But again, I can look into it for you.
Thank you.
Yep.
Mel, what we've seen is we've had a couple of situations where the nursing homes are pretty strapped, and they won't take someone who's COVID positive.
Yeah, kind of wondered about that. Apparently there's several beds, but I don't know their staffing issues, or, maybe it is related to that. I just thought they'd rather say that than she doesn't qualify.
Yeah, I don't know either. That's just the situation we're in.
Thank you.
We did get 80 COVID tests during this call. So at Black Hills Special Services, we got some tests.
Awesome, thanks.
Anything else to bring forward?
Well,
Okay.
I was just going to say, knowing that we're all going to be together again in about 10 minutes, we can probably end this. If there aren't any other questions or comments, we sent out the agenda for our stakeholder meeting happening at 3 o'clock Central Time yesterday. So any things that come up or you might think of in the next few minutes, we can try to add to the agenda there. So we'll give people a quick opportunity to take a break, and then we'll reconvene at 3. Sound good? All right, we'll see you all soon.
Thank you.
Thanks. Bye.